during our lifetime. And I think most of us who are present today, those who are above 40 or 50, all of us have worked during Latur earthquake. And as Matthew rightly said, one of our achievements has been to document the learning from the Latur earthquake. Praveen, you can put off this video for a while. I mean, my slide presentation. Let me do this preamble and then I will come to the slideshow. So, the strength of civil society is that we learn from all these experiences and move from that stage to another stage. And that's why the response that we gave to this pandemic today was actually a kind of more mature response, and that we had learned from all the last 30 years or so. And there have been several examples. I mean, when we were undertaking relief during Latur earthquake, I will just give one small example that at that time it did not occur to anybody that we should be providing sanitary napkins to women. Those who have done the relief work may remember that lots of saris were coming from Mumbai, Pune, and they were being distributed. But nobody thought that saris don't go alone. Saris need petticoats. And you have to have petticoats first and then saris would be useful. Because it was always easier to procure saris and send them, but it was very difficult to procure petticoats and then give them with the saris. So that was one of the learning. And similarly, as I mentioned, nobody remembered that sanitary napkins will be needed because at any given time, around 20-25% women would be undergoing the menstrual cycle. So they would be needing that. And during the time of earthquake, when they had ran away with leaving everything behind and most of it was destroyed, this need was very apparent. And so one of our learning was that gender needs and necessities were should be first considered, and that was the learning which we put up in various documentations, and subsequently now that has become part of all international relief materials and relief aids and so on. So it was the civil society response which identified this particular gender need, both strategic gender needs and other needs, and then only they have become part of the international response now. So similarly, during the present pandemic, it is this learning that if we could present to the broader society, then it would be helpful to understand what actually we should do, what we could do, and what how we would be proceeding forward. Otherwise, you see, the kind of society we are living, there are disasters are always happening. A fire somewhere, floods everywhere, rain slashing the cities, once in a while earthquake, and so on and so forth. But unless we learn from this, there is hardly any point in providing the response. So it is from this angle we have undertaken this documentation, and that's why it is called learning the lessons. Now, as you are seeing on the screen is being shared, and some of the earlier slides which came up there, they showed the work done by CYDA, and something which you have already seen in the video. So those quick slides we have shown. The present slide, Praveen, are you monitoring the slides? You can go to the previous slides,
Yes,
please.
yes.
No, previous one.
Start from beginning.
Yeah. Yeah, okay, we can start from that and we can quickly move to the next. Or if you allow me, I could move from sharing my screen. Okay. Okay, so as you can see from this, let this be. Uh, the video has already shown that a number of campaigns were undertaken. So this is a distinguishing mark of CYDA, that it worked in a campaign mode. It did not just work in a relief mode, but it organized variety of campaigns, and some of these campaigns you have already seen. No one shall go hungry, and then the achievements are there. Similarly, the Migrants Matter campaign. Next slide. The flushing the virus. because when CYD was working within the communities, and these are the names of the communities, that flushing the virus from the community was very essential from the grassroots point of view, and I will discuss it later. But you please see that these are the communities from where the virus was literally flushed out. Next one, please. Yeah, and then this "No One Shall Die" because of COVID-19, this campaign out of which these activities were undertaken. Next one. Hmm. And then, as you have seen in the previous slide, uh, CYDA has mobilized financial support from a variety of donors, more than INR 37 million. Now, this is commendable, and it also shows that people trusted CYDA. The reason for showing this number is that many donors trusted CYDA. And as we will come to the lessons, this is a very important thing, that during emergencies and during calamities, it is necessary to have trustworthy partners where you can trust, where you have trust in their effectiveness, in their efficiency, their transparency, and their accountability. So this is very essential, and that speaks for the excellent credentials of CYDA, that it could mobilize this kind of support within a short period of time. Now we will move to the next slide, and there we will see some of the best practices which we have learned from this. So the first thing that struck us is that division of labor was very well attempted. That CYDA had a number of volunteers and number of staff workers. So assigning them different responsibilities, because you could imagine it was a lockdown situation there. Nobody was allowed to come on the streets or get out of the house. At that time, to assign responsibilities and coordinate the work would not have possible because in the absence of division of labor. So, in any such calamity, the division of labor is very important. That you must have coordinated, properly calculated, articulated plan of action, and the work should be assigned to different people. You just yourself can't think that I will do everything and other people will just sit behind. That can't be done. So, division of labor is one of the best practices. Then second is delegation as well as self-dependence, because many times when you go into a community, the issue always comes up that whether you should delegate the responsibility of distributing the relief to the community members, or you should yourself stand there and then distribute it. Now both the things have its own pros and cons. So if you delegate, then you have the doubts whether the relief will reach to the proper people or not, whether the needy and those deprived, whether they will get it or not. And as you know, in many rural situations, as we often hear, that the stalwart people or the sarpanch and other people, they take away all the relief and keep it to themselves. So that apprehension is there in terms of the relief agencies. But unless you really delegate the responsibility, you cannot achieve your aim. So both these have to be very carefully monitored, delegation as well as you do it yourself kind of thing. Then thirdly, coordination without getting co-opted, because during this pandemic, work had to be done in collaboration with lots of political representatives, or what we call nagar sevak in the urban context. And these political people were always there. Now you have to deal with them, you have to negotiate with them, you have to work in harmony with them, and you have to coordinate with them without getting co-opted, because most of them would have their own political agenda. They will have their own party affiliations, and they will have a variety of political self-interest. So balancing those interests are is very crucial thing, that you don't want to get co-opted, but you still want to work with them. And this is a very crucial thing that many people wouldn't understand. It is not written anywhere in the books as to how to deal with a corporator or how to deal with a mayor of a city or something like that. So you have to learn it yourself, and you have to be very careful while dealing with them. But at the same time, you want to deliver the goods and services to the people. So this is the third thing which was very carefully done. Then balancing the means and ends, because in such calamities, resources are never sufficient, and there were many instances where when the CYDA went to a particular community to distribute relief, they had say 50 packets, but there were 100 people waiting there. And the moment they came to know that such and such relief is being distributed, a lot more people would come. Now what to do in such a situation? You have only 50 packets, but there are 150 people. So what are you going to do? Are you going to just say no, we will just distribute 50 and then rest should go empty handed? So this is a very delicate and very traumatic occasion for any social worker when he or she goes into the field. So balancing those means and ends is also a very crucial thing, and CYDA people had done it very well. I mean, if you talk to them in private, then you'll come to know what are the strategies and techniques that they have been adopting to manage this. Because as you know, resources are never sufficient and the demand is always high. So this is also a very crucial task. And as the Dilmer said in the opening address, harnessing youthful energies was one of the hallmarks of CYDA. That in such pandemics and calamities, it is the youthful energy, it is the youth who are really the front runners for providing this relief. And CYDA harness these youthful energies very well, and because of that, most of the work could be accomplished. And then, in the same context, what is important is conquering the fear, because all of us know during the first 3 months how fearful we were, and the fear was of various types. First fear was that of coronavirus, and it was being said that the moment you step out, then the coronavirus will attack you. Then the fear was of police repression, that if you are caught somewhere on the street, then the police would book you. And then there were different types of fear, whether you will get the milk or whether you will be able to see your beloved ones, whether you can see the acquaintances, etc., etc. So conquering this fear was a very crucial thing to achieve, and CYDA volunteers have really done this. They first conquer their fear, and then only they could accomplish many variety of other things. And in the same line, the last thing is submerging one's ego, because when you do relief work, you have to really forget your ego, that I am somebody, I am a social worker, I am an MSW, or I am a PhD. And then how can I do this sometimes the dirty job of distributing the relief, and people demanding, and sometimes people also abusing, sometimes they come on you and then they say many things. So at that time, to keep one's cool and undertake the relief, sometimes, or many times, you feel that this is a thankless job, that we are distributing the relief, but these people who are receiving it, they are not thanking us. And it is also the other way around. Sometimes you yourself expect that they should be thankful to you. Now, both the feelings are not really rational, that you can't expect them to be thankful to you, but you get that feeling that they should be thankful to you. So, these are all different types of clashes that come to the minds of social workers. And these are again not documenting in any book. So, one has to understand it, one has to practice it, and then alone one could really undertake the relief activity. So submerging one's ego is a very crucial step, and all of you must have experienced that one's ego should not come into the picture. So these were some of the best practices, but there were also certain limitations and caused because of the pandemics. So that we will show in the next slide, the limitations part. Okay. So this, as all of us know, the relief work had to be carried out under severely restrictive conditions. And all of you know that mobility was not there. No, you stick to that slide only. Stick to the earlier slide, please. I'm saying that relief has to be carried out in under very restrictive conditions, because see, if it is an earthquake or flood or something, then usually it is not affected. You could take the jeep and you could reach the place and you could do many things. But here, the situation was so terrible that you could not get out onto the street. So how could you distribute relief? How could you talk to people? How could you console them? So that was a big issue, and this space for the civil society was not provided by the state or the local government authorities. All of us have known how difficult it was to get the pass and then move on to the streets, and how difficult. I mean, you get one pass and you wanted to go to several places, etc., etc. So this empowerment of CSOs, which the state should have undertaken, that did not happen, and that was major limitation faced by many agencies. Secondly, the enormity of the situation was very overwhelming. When calamities like earthquake or floods they strike, they do not strike the whole country. Earthquake is a localized version, maybe 15 kilometers, 20 kilometers, things happen. Or floods are there certain into the river basin. Or if a fire or something breaks out, then it is covering a building or a community. They are always a kind of localized calamities. But this particular pandemic was not only affecting Pune city or state of Maharashtra or India, but it was affecting the whole world. And that was very overwhelming, and it was, and in such circumstances providing relief was beyond the capacity of any small organization. And organizationally also there were restrictions, because you could not mobilize all your people, you could not call them to work, and then you could not provide them the necessary facilities, and so on and so on. So, in normal circumstances, you could have deputed many social workers, but in such circumstances, it was very difficult to do this. That was another limitation which under which work had to be carried out. So, let us go to the next slide. Yeah, and then normally you have a trajectory of relief to rehabilitation. That when you in any calamity, when you undertake relief work, you start from relief, then you go to restoring the livelihoods, and then you start try to do rehabilitation and so on. So that full cycle when you run, then only the full impact of relief efforts is achieved. So in this case, that could not happen because of again various factors. Then thirdly or fourthly, uh, those agencies who were doing this relief work, they were not necessarily a medical or public health agency, and the kind of wherewithal which was necessary was not with them. In other disasters, yes, you could gather experts and you could have technicians, and then you could deal with it. But in this present case, there was a serious shortage of medical personnel, medical equipments, medicines, and so on, and that was not within the purview of voluntary agencies. And lastly, the overwhelming dependence on police was also a matter of serious concern. Now, the police did a good job, they, to the best of their capacity, but bureaucracy, especially the government people at various levels, local, state, and others, were lethargic, and also partly they were not allowed to come onto the streets. And the crucial departments like collectorate or PWD or health and others, they were kind of disinterested, and they were not coming forward to help the people, and this had dampened the social response. I mean, if you compare this with other disasters, you find that the government machinery works over there, but because of this very peculiar nature of these disasters, that kind of thing did not come. And in fact, it was the police who were doing most of the other duties, and they were not cut out for this kind of job. Police are meant for, I mean, maintaining law and order, investigating crimes, and so on. They are not good at making the lists of beneficiaries, arranging bus transport, and assigning coupons and things like that. They did that, all right, but that was not the proper mechanism to do the relief. So let's go to the next one. Yeah, next slide, please. Yeah. So now, with those limitations and best practices, we come to the findings. And there, uh, first thing that we notice is that although this coronavirus was very novel and very kind of deadly, we have been having the series of viruses over the last 15 years. And all of you know swine flu, dengue, chikungunya, bird flu, and so on and so on. So it is not that we did not anticipate this kind of impact, and we were not prepared for it. For example, in Pune city administration, the PMC, Pune Municipal Corporation, they were warned of such a emergency, and they were asked to prepare for this emergency. And they were asked to prepare for this emergency.
मिलिंद सर आवाज आ रहा है? मिलिंद सर your voice is not clear. हाँ मिलिंद सर का इंटरनेट प्रॉब्लम है.
स्टॉप शेअरिंग करून परत शेअर करा नुसतं निघून जाईल. आता ते
Okay. मिलिंद सर
Okay.
हाँ सर.
And
I think we've lost Milind. He has dropped out. Perhaps he's logging in. Praveen?
Milind just lost the connection.
Yes, yes, yes.
Anand, are you there?
No, he's. We can see Milind right now, but
He lost the
Anand
connection.
is there. Anand.
He'll come back.
Yeah, he's back.
Anand is there.
हाँ आनंद is there. Yes, yes, yes.
Hello.
Yes,
Ah,
Milind.
Anand?
Hello, I'm sorry. I lost the connection in between.
Okay,
And
so it's
I
back.
think now it is restored.
Yeah.
Okay. Yeah. Okay. So I'm sharing the screen now. So I was saying that the series of viruses offering would be really, I mean, a matter of concern, and Pune Municipal Corporation should have actually taken stock of that. And secondly, the nature of this virus and its epidemiology remained a baffling phenomenon even 1 year after its first occurrence, that epidemiologists themselves are not able to figure out. That's why we hear that the virus has mutated and the virus is showing a different version. And that's why this whole vaccine also has a kind of apprehensive response, that people don't know whether this vaccine will be useful to the version of the virus and so on. Now, as far as lockdown, there was a general consensus on the need for lockdown, uh, but the way it was implemented was highly controversial. And it has been now agreed that uh, instead of clamping the nationwide lockdown, it would have been advisable to selectively isolate those areas. For example, in the initial months, all the patients were concentrated into the big metropolitan cities where the people had come by the flights and through airport and so on. So it was possible to contain them there. At that time, distant areas like Arunachal Pradesh or Kutch or Tiruchirappalli and all other places, they were not affected by the virus. So there was no point in locking down those areas. But this was not understood. There was a this kind of thing that we will do a nationwide lockdown. We will do something magnificent, and the government was carried away by that particular feeling, and that's why this particular thing happened. So the next slide, please. Yeah, show the next slide. Yeah. And then we came out with this term of social distancing. What we meant was physical distancing, but we actually were talking about social distancing quite wrong. I mean, in a country like India, when there was already people were divided and there were lots of social distancing,
बाद में I think problem है. हाँ मिलिंद सर. मिलिंद सर आपका आवाज नहीं आ रहा है.
Yeah, there have been some network issues, and I think we have to make do with them. Uh, I hope you are able to hear me.
Yes, Milin, go ahead. We are
Yeah,
hearing
Matthew,
now.
can you hear me? Okay, okay.
Yes, I can
Fair,
hear
fair
you.
enough, fair
Please
enough.
go ahead.
So this, yeah, okay. Epidemiologists had suggested the strategy, and that should have been sort of surgically applied because we had this. So that surgical strike should have been done in metropolitan cities, and then that would have really served the purpose instead of clamping the nationwide lockdown. Praveen, next slide, please. Yeah, please show the next slide. Yeah, here it is. So this that was a big error of judgment that while lockdown would stop the virus, but that actually did not stop the virus. It stopped all kinds of work, and it was thought that if we stop the mobility of the people, then virus will be arrested. But it actually did not happen. Only the work of all kinds was stopped. So the lesson is work by the able-bodied people with due safety and precautions should have been continued, and only the sick and elderly should have been asked to stay indoors. That would have been a proper strategy because many young people were just loitering on the streets or just sitting idle, and their energy was not properly utilized. And as we know, the lockdown was imposed mainly to buy time for the health machinery because health machinery was not equipped. In any city was quite inadequate even to provide basic health care, and it was ill prepared to face the pandemic. And that's why the whole idea of lockdown came into existence just to buy time for the public health machinery. Please.
नेक्स्ट मिलेगा. हम्म.
Yeah, next one. Yeah, show the next slide. Right.
Yes.
Now, silver lining to this otherwise dark situation was that Indian civil society responded very spontaneously and wholeheartedly. I mean, there was no precedent, nobody knew what was happening, but the way people responded, especially small organizations, their networks, talking with each other, and many people, they just came forward and then they tried to help the society. So pandemic was huge, but the civil society response was also phenomenal. And the same thing happened in Pune. That CSOs in Pune also responded enthusiastically. But unfortunately, the Pune Municipal Corporation was not equipped to solicit this response, and they could not make effective use of the civil society participation. And this was because they had never thought of this, that one has to work in collaboration with civil
Oh,
society
okay.
organization. You can't do things on your own, and a proper mechanism for involving the civil society, soliciting their role, was never put into place. Compared to this, the Pimpri Chinchwad corporation next door, they had a better disposition, and they immediately enacted some such mechanisms, and that's why the response on that side was much better. And also, there is a structural lacuna, which was that uh, involving people's participation in decision making and civic affairs was not done. And this has been actually the aspiration of the 74th Amendment to the Constitution, just like the 73rd Amendment introduced the whole idea of Gram Sabha and people running the show at the village level. Similarly, that idea has been there in the 74th Amendment as well, but necessary legislations have not been made, and that's why urban people like us, we have to just be helpless spectators to what is happening around us. We are not endowed with the necessary competence, the necessary means, mechanisms to participate into the governance, to control the city administrators, and so on. So that was the basic thing which really affected the response of the Pune Municipal Corporation or other corporations for that matter. Yeah, next one, please. Hmm. Now, as I mentioned earlier, this community work which was undertaken in a community like Yeroda, we have studied that as a case. And Yeroda is a big community, and working in such a community is a very challenging job. So what was done actually was to involve local volunteers and divide the community into smaller units. Once you did that, then it was easier to kinds of things: the initial relief, then the distribution, then awareness raising, and so on and so forth. So that is something which one has to really understand when you are working at the grassroots. That you solicit the help from local people, you delegate the responsibilities, and then you arrange the matters in such a way that relief distribution could happen in a very peaceful manner, and remove the fear from the minds of the people. And that was done with this flush the virus out of the community, and undertaking various steps, and that showed tremendous results. That Yeroda community for first 1 month or so suffered very badly, but once all these things were put into practice, the cases filed, they were taken to the hospitals, people's awareness was raised, and so on. Then both the things happened, that the people become fearless, and also the number of cases came down drastically. One could say something like Yeroda model, and which rests on the principle of decentralization and participation by all. So this is a very crucial learning that we will document subsequently. Yeah, the next one. Hmm. Now we have seen in the video suffered by the migrant laborers was the most pathetic situation, and this was something which shook the whole country, because something like this was not seen after that. This kind of trauma, where thousands of people were forced to walk the streets, and women, children, pregnant women, and the way they had to do this journey was phenomenal. And that's something, this trauma could have been avoided if they had been informed in advance about the impending lockdown, but that was not done. And real issue was that such a labor force was invisible to the policymakers sitting in New Delhi. That is the real thing. Those people who sit in the capitals, they don't really understand that the country is not run by them. The country is not run by people sitting in New Delhi, but country is run by those ordinary common people who labor, who sweat, who are working at machines, who are running shops, who are running different establishments, and those who toil on the streets. They are actually running the country. But this fact was completely forgotten, and this is the kind of telltale remark on the situation in our country, that we don't really understand who is running the country, and that is why this labor force had to suffer a lot. So let's go to the next slide. Yeah. And then they have been called as migrants because they were seen on the roads, they were villages, and so on. And so the term migrants was used, but actually they were all unorganized sector workers, and under different categories like building and construction workers, hawkers, miners, domestic servants, contract laborers, tailors, sugarcane cutters, and so on. So important thing was to understand what category they are in. That they are laborers, they are contributing their labor to the economy. This was something we should have understood. But our whole system, our whole socio-economic system is based on the principle of exploitation of labor and laborers. All of us, in our own capacity, try to exploit the labor whenever we get a chance. Whenever a housemaid comes to work with us, we try to cut down her salaries, we try to negotiate, and then we feel happy that we are able to get somebody at a lower wages or something. Or when we go to even buy vegetable, at the same time we say, if she is saying methi for 15 rupees, we say 20 rupees. rupees, then we say no, we want it at 10 rupees and so on. So it's something that is kind of if you get a chance, you should exploit the lower person, the person who is on the street and so on. No, keep on the previous slide. So this exploitation of labor is the bottom line that is happening in our country. And no, I think keep to the previous slide. There is last point that I want to make there. So this is something we really no. The next one, please. Hmm. Yeah, this is good. So the significant lesson is that every laborer should be endowed with uh, labor legislation, and the social security cover should be given to every laborer who is working in the country. So that is the real bottom line. Now, as a part of the relief work, we also realize that our society consists of a lot of deprived population, something which who have been suffering from social exclusion, and that includes sex workers, third genders, peripatetic traders, street squatters, nomadic communities, and so on. And they have always been the victims of social exclusion, and their predicament, their status, their situation increases manifold during social emergencies. And this is something very badly seen with regard to sex workers. Now, if you look at the total number of sex workers in the country, it will run into thousands. And all of them could not carry out any of their trade because their trade is based on intimacy, and this was completely stopped. So you could imagine what must be the status, what must be the plight, and how they must have survived, because none of them have bank balances and so on. And then if you don't allow them to do their business, then how are they going to survive? So these deprived populations uh, were not seen by the state or the public administration, and it was only like agencies like CYDA who identified such persons and extended assistance to them. And all of you know the efforts that you have done towards helping these people. And we have met many of these people, and they were really very thankful with tears in their eyes that it was because of such agencies that we could actually survive. And then this is also an agenda for social work, that you identify such populations, and then you forge long-standing relations with them so that future programming can be attempted. Yeah, next one, please. Hmm. Another problematic thing was the public distribution system. And as all of us know, in the last 15 years, there has been a systematic dismantling of public distribution system. Now, those of us who have seen last 30 years or something, earlier public distribution system, that is rationing, was where you get the grains. But now, these days, uh, this is totally dysfunctional. I don't think anybody buys grains from PDS. So, if this system had functioned correctly and delivered benefit, then much of the trauma suffered by poor people could have been avoided, and it would have also eased the burden on the civil society. That people would have bought the grains from those system, and they would have survived. But because there was dismantling of this system, the trauma of the people increased manifold. Then earlier mention has been made of the Gurudwara, uh, particularly the Pune camp Gurudwara Sabha, which has really done tremendous job. And at the peak of the calamity, thousands of hot meals or midday lunches were distributed by them, and they were given to the needy people. Similarly, a group called SAD, a group of young activists, they also provided selfless service, braving all odds and hostile environments, and helped hundreds of laborers. And some of their accounts have come into the magazines, and some of the young guys, uh, they are extremely highly educated people. They are not uh, just like, I mean, it is not that they were without jobs or something like that. They kept aside their vocations, and then they entered into this, and they provide selfless service. And this is a great thing about India's youth, that India's youth can respond to challenges when such calamities come, and those who are having pessimistic visions about India's youth, and it's a common practice to have such vision, they should really learn or understand from this that when it comes to such situations, the youth do not go behind and they come forward and help the people. So next slide, please. Hmm. So the basic finding of our study is that the country lacked the basic administrative and health infrastructure to face a pandemic of such proportions. And unfortunately, critical attempts were not made to assess the situation and deliver real benefit to people. And the state followed the colonial policies. I mean, the 1897 Epidemic Act, which was a British act, and it had not been modified for more than 100 years. And the same act was clamped again. We had not even thought that we should be changing that act and we should be having something else. So that same colonial policies, and many people remembered what was happening during Lokmanya Tilak's time, and why some of the Indian freedom fighters had to take up arms at that time, because atrocities were committed against the people by the police at that time. And so the same kind of colonial draconian laws were again enacted, because we had not uh, we did not have any other means of doing this. And then second was this National Disaster Act, but that was not really suited to this kind of calamity. Disaster Act is not there to restrict people's movements or something like that. So restriction of people's movement was done by a very colonial act enacted 100 years back. So that was something which showed. And the state also did not understand the role and contribution by the civil society. And they did not, even today, this role is not properly understood. That it is the civil society, it is the social response from the people which actually is benevolent, and it actually saves the people from such calamities. And this is something which the state should really understand. And subsequently the kind of revisions made into FCRA rule and the kind of changes they have made, it clearly shows that the state is totally ignorant about the role and contribution by the civil society. So these are our broad findings, and we will now move to the next slide, where we are documenting the lessons learned. And these lessons we have categorized them into 6 sectors. So the first sector is civil society. That is the lessons that the civil society organizations should learn from this whole pandemic. And as all of us know that when such things happen, social organizations are often caught unawares. We don't know, in case of earthquake, maybe uh, there are places or floods, yeah, some warning can be received. But in such cases, there was no warning. So how to respond to such calamities, how to garner resources, how to correctly identify beneficiaries are various issues and with which the civil society organizations have to deal. So what we have noticed and lesson is that those CSOs who have the mandate to work in disaster situations need to maintain a state of readiness. And that state of readiness involves training of staff, both program and office staff, ensuring that all the staff has life skills like driving a vehicle, swimming, or even tree climbing, or working under stress, and so on. And then you have to maintain also the inventories. You need to know who is the supplier, who is the vendor, from where you can get tarpaulins, from where you can get bicycles, and so on and so forth. So that readiness has to be there. Similarly, staff insurances and staff safety also should be there. That if staff are moving around on the streets, then they should be properly insured. Then only they will be able to function. So this is something we have documented, and as you see the whole report, you will come to know the details of this particular readiness. Yeah, next one. Hmm. So at this time of emergencies, what one has to do is that you have to immediately set up command and coordination mechanisms and establish the communication channels. Most importantly, you have to do needs assessment and very quickly, and then that thing needs to be refreshed continuously. And as I said earlier, division of labor and distribution of responsibilities have to be made. Then a system of daily feedback, follow-up meetings has to be institutionalized. And situational reports have to be prepared and shared with all the concerned agencies, donors, and so on. So this is something you have to do at the time of emergencies. Yeah, next one. Hmm. Now, the second layer is that of communities, that the communities are both victims as well as participants. You can't just treat them as victims because they are also active agents into it. And issue is how to solicit their participation. And because they are sufferers at the same time and you are asking them to participate. So, how to do it? So, the bottom line is that NGOs and voluntary organizations have to have proper rapport with the community. If you have very good rapport with the communities, then you can do many things. But if you don't have that, then your relief work gets hampered. And what kind of rapport you need to have? So you have to have engagement with the most vulnerable sections, like I mentioned earlier, that poor first, or we give priority to the poor and deprived. That should be the philosophy. Then secondly, real needs have to be very quickly identified. You don't have time at that time, and so quickly you must understand what is the real need of the people. And then participation of and by the communities, that is very, very essential, especially of women, because women know the household needs best, and they only understand what is necessary for that household at that given time. So involving women is a very, very crucial step at the community level. Next one. Hmm. And then for doing this, local associations and self-help groups, which are, why I'm saying self-help groups, because this is a omnipresent reality. Now, virtually there is no community or no village in the country which wouldn't have self-help groups. So SHGs are there everywhere, and it is best to solicit their help during such calamities because they are a centralized kind of entity. And then, as I said earlier, large communities have to be divided into smaller units, and local committees should be established there, which should be accompanied by public awareness drive and then transparency mechanism. Transparency is very essential. If you make it open and transparent, then a lot of ambiguities, apprehensions, mistrust, doubts are removed. And so maintaining transparency is very essential. And needs assessment should be done with the local people. We shouldn't be just, as social workers, we shouldn't think that we know what is their need. No, it doesn't happen. People know their need and they will come forward with that particular need. Next one. Hmm. So now at the level of donors and supporters, what do we have to do? See, at the donor level, the crisis situation warrants immediate decisions. You don't have time again, and you have to identify, because donors often can't do everything by themselves. So you have to identify a trustworthy and competent partner. And secondly, careful monitoring is warranted while maintaining a humanitarian approach. You just can't have a very, business-like approach there. Humanitarian approach is very, very essential, but careful monitoring also has to be done. So how do we do that? So now donors need to really include disaster response as part of their strategic programming. Just like livelihoods or natural resource management or women's issues is a part of your strategic programming, disaster response will have to become a very, very essential part of the overall programmatic goal. And now you have to incorporate pandemics and health emergencies into the whole disasters, because perhaps we may be able to control floods or other things, but pandemics is something which is going to happen, and we should be all prepared for dealing with them. And participation is desirable in situation appraisals and needs assessment. To the extent possible, you should participate into that kind of activity, and that's how you will get a better feel of what is actually happening onto the field. Yeah, next one, please. Mhm. Now, at a donor level, this particular thing, flexibility, had to be maintained in identifying the beneficiaries and communities, because you can't have preconceived notions. You can't just say that we will work only with children. You can't say that we will work only with age-old people or something like that, because that situation demands different kinds of approaches. So flexibility will have to be maintained, and most importantly, micromanagement should be avoided, because Many times donor representatives, especially our project officers, they tend to do micromanagement. They think that no, because we are giving resources, you should do whatever we say. So that micromanagement should not be there. Once you select a competent and trustworthy partner, then we should leave to the field teams to take the decisions, and you could participate into that. And ideally, donors should hold periodic roundtable conferences among themselves so that they can exchange the notes. They know about each other's partners, they know about each other's programs, and then they can take studied decisions. And this is very essential, especially in metropolitan cities where a number of donors or donor representatives are there. And similarly, they have to also engage with local and state government, because very often we don't tend to interact with them, but we should be interacting with the mayor, with the standing committee people, and other secretaries of the government, so that you know what is exactly happening at the government level, and then that informs our decision making. Yeah, next one. Hmm. So at the local government level, now, local governments, in such pandemic situations, the directions come from state governments and central governments, but local governments are the real executive agencies, and they should be having the necessary preparedness because they are the people on the ground. And if they are not prepared or they are not equipped, then whatever big slogans or schemes that you may announce, they won't get into practice. So this is very essential, and their efficiency and efficacy decides what kind of relief would be given to the people. So what are the lessons learned is that action plans with regard to various disasters should be prepared in consultation with citizens, citizens associations, and CSOs. And this is something all the local governments should now do, because different types of pandemics or calamities are going to affect, and we should be prepared for that. And most importantly, complete and heartfelt participation should be sought from the people, not just nominal participation, but we should have real participation from the people. And then there are various means of doing that we will see in the next slide. So next slide, please. Yeah. Local government now, consists of both political representatives as well as a kind of bureaucracy, and it is the political representatives, the Nagar Sevak, who are really calling the shots. So they should be properly trained from specialized relief and rehabilitation agencies. That many political representatives, they say that we don't know what to do exactly in such situation. We do whatever comes to our mind. But if they are properly trained and properly made aware of, then a lot of flexibility or a lot of, cooperation from them could be given as to really influence upon the local administration. And what was really seen during this pandemic is that a permanent liaison unit is needed at the municipal level, and it should be directly accountable to the municipal commissioner. But something very crucial, that maybe you have a person at the municipal commissioner level, but the actual delegation of responsibility should be happening at the ward office level, because in metropolitan cities, ward office is the real executive office, and many times we neglect this fact. Ward office is endowed with all the necessary systems, and they are the ones who are actually delivering the services. So this particular listening function should be undertaken at the ward office level, because our cities are pretty big now, like Mumbai, Pune, Nagpur, Kolhapur, Jabalpur. They are all big cities, and there many NGOs are working. Now all of them can't be contacted at one single level, but a local ward office, like for example, if there is a ward office in Pune, say Kothur ward office, then they would know the agencies which are working in their area. I don't know who works at the health level, who works with children, who works with women, and if they have a roster of such agencies, then effective liaison can be built, and this should happen at the ward office level, not at any central level. And as I said earlier, this institutionalization of the area sabha, mohalla sabha, or community sabha is extremely essential, and that is the aspiration of the 74th Amendment to the Constitution. as all of us have seen that following the 73rd Amendment, Gram Sabhas have been endowed, but Area Sabhas, Ward Sabhas, they have not been formed as per the aspirations of 74th Amendment. So this is very essential that you really empower the people in taking the decisions at their local level. And if that was happening, then people would have come forward and participate. Yeah. The next slide. Okay. So, what are the lessons for state and central governments? Basically, the real issue in our country is that state is a contentious issue. Now, the nature of our polity is such that India is both a federal as well as a unitary kind of nation. We give due importance to the center, that is government in New Delhi, but we have to give equal importance to the governments in state capitals like Mumbai or Bhopal and so on. So they have their respective roles. And the if you look at the constitution, then the constitution suggests that in case of guardian role in disasters, and the actual delivery, actual relief have to be done by the done at the state level. But unfortunately, in the current pandemic, the center used sweeping powers which they had acquired from the enactment of these two acts, and they were trying to guide or direct the state, which was not a good practice and which caused duality. You had to look at the prime minister to for certain decisions, whereas the decision was to be actually implemented by your commissioner or your chief minister at the most. So this kind of duality really has to be resolved early when such pandemics come into that, and the spirit of federalism and federalism should be retained. One should not think that I am the custodian of this whole country and I will decide what should happen into the country. That kind of unitary decision making can't happen in this country, and federal character needs to be preserved. That is the lesson which we have learned. Secondly, the gross neglect of public health expenditure has really cost us a lot. And all of us have been clamoring that at least 3% of the GDP should be given to public health, but at present it is only 1.16 or something. Only that much expenditure is being made. So if we had really equipped our public health system, then we wouldn't have been facing this calamity of this sort. And secondly, the state and central governments really have to avoid wasteful and useless expenditure, which is not productive, which is not delivering any goods to people. And instead of creating statues and monuments, I think we should create hospitals and other facilities. And I remember Mahatma Gandhi had advocated that the Viceroy Lodge, that is Rashtrapati Bhavan in New Delhi, should be converted into a hospital. And he was very much against the colonial rule, but he did not prescribe breaking down the Rashtrapati Bhavan. He said that let us use it as a hospital, let the people of India use it as a hospital, and that would be the real benefit to the people. But we haven't done that. You know what is the status? We just maintain that big majestic structure just to house the president, and we are not even allowed to enter into that. So that is the same attitude is put into our polity, that we shut down useless structures and we forget the essential or vital things that we should have been doing, and that cost us a lot during pandemics. Yeah, next one, please. So this again goes without saying that decentralized decision making is essential and it should be encouraged. And another thing is that in health management, infectious and communicable diseases should receive priority. Now, following the examples of the Western countries, we have been neglecting these functions. In Western countries, they are concentrating on lifestyle diseases because they have moved into that stage. They think that they are free from infectious and communicable diseases. And that's why there was a paradigm shift in Western countries, but we have blindly copied that. But our reality is different, and we should give equal attention to communicable diseases, and which means that we should have virology and epidemiology research on a very big scale, and we should be ourselves doing this. What we have done presently is not sufficient. We should be having more and more scientists working on that. And lastly, uh, again, the state should develop the capacity of public health institutions, both human and physical. Because when we interviewed with the mayor of Pune city, we were told that there were no qualified doctors in the service of Pune health department. They were just making do with Ayurvedic doctors or homeopathic doctors. Qualified allopathic doctors were not in their service. So, how come they would deliver the services? So that preparedness ought to be there if we really want to face such pandemics. Next one, please. Yeah, and then another major mistake was that in such epidemic situations, the captain should be the health department. The police, the superintendent of police should not be the captain of our efforts, or collector should not be the captain. It should be the district health officer who should be leading the battle because he or she is the competent authority to deal with the health calamities. And this function should not be entrusted to police or revenue authorities. And similarly, public distribution system should be immediately overhauled because that is very essential for from the standpoint of poor people. Our policy making is extremely elitist, and we only take the views of the privileged people. And privileged people don't need rationing cards and wheat on the ration, so we completely neglect it. But poor people need that food, and that should be system should be in place. And lastly, this labor legislation for all unorganized sector workers should be completely reformulated, and welfare boards and other security measures should be immediately instituted for every category of workers. Now, only a few categories are covered with the labor welfare boards, but all laborers should be covered under social security so that in such pandemics and calamities, they are not the sufferers. Yeah, next one, please. Hmm. The state also should understand the utility and efficacy of civil society and should not adopt kind of coercive approach towards voluntary organizations. The state tend to have this attitude that voluntary organizations are disrupting the so-called national progress, and that's why you should clamp down more and more restrictions. But that's an extremely wrong position. That you should create a very conducive legal framework, and you should have the approach of let 100 flowers bloom. That people think that there are many voluntary agencies, but that is not the case. We need to have more and more of voluntary agencies, and that environment had to be created. And lastly, these reforms in urban governance that has been totally lacking, and participatory democracy, direct participatory democracy with citizens' involvement is critically warranted at this stage. Yeah. Next one. Yeah. Now there are also lessons at society at large. I mean, we can't just be showing fingers to the state and local governments. As a society, also we have to learn a lot. And the nature, the structure of determines how it would take the impact of pandemic, and especially in cities because we have been sitting in city situations. So disorganized, stratified, unequal, and anomic nature of Indian society demands a lot of introspections because our traditional structures are broken, but we have not been able to introduce new secular structures which will allow building of our society, and that's why we have suffered in this calamity. So the societies will have to be self-disciplined, and when they are not, the control goes to the government and police. So it's like situation at any signal you can see. If you are careless, then the police has to come and then. But if you are disciplined, then police is not required. Secondly, instead of smart cities, we should be aiming at inclusive, healthy, and joyful cities, and that should be the motto, covering all the populations. It should be healthy from environmental point of view, and it should be joyful that every citizen should feel contented, happy, and enjoy joy of being city. So that better city planning is extremely essential. Next one, please. Yeah. So So self-disciplined and self-governed communities, populations, and citizens should actually share their lethargy and
Hello.
I think their connectivity issue.
Okay, thank you very much. I think it is almost the last slide, and we can get
yeah,
into
yeah,
the.
I
Uh,
had almost completed.
yeah,
Yeah,
yeah.
and then you could read things in detail in the report, which is being released by CYDA, and it is going to be uploaded. So there you will find all the details. I'm really very happy that you organized this function and had me present the report here. So
Yeah.
thank you very much.
Thank you very much, Milind. And it was really an elaborate, beautifully explained the findings and the learnings, and not only looked into just one aspects of it, and various aspects at the administration level, at the civil society level, at the people level. And I think Milind took the pain to meet more than 50 people from across various sectors, and this report is outcome of those experiences. It took more than a month to discuss and meet people. I know that many people have questions, and also maybe some suggestions and clarification. And I request people to put into chat box those questions. And we have a very interesting sharing from the Maharashtra perspective from Mr. Anand Gotke. I mean, I'd like to introduce, thank you very much, Milind. Once more, we will, take up some few questions later. I now like to introduce Mr. Anand. Anand has completed BTech and MTech from IIT Kharagpur. He has been working with various NGOs with a special focus on natural resource management and water sanitation and hygiene. We know that during this epidemic, wash is very critical, role, and that was the only one maybe solution to arrest the chain of infection. And Anand has been has experience of working with various state governments, including Rajasthan, Himachal Pradesh, and very extensively in Maharashtra. And for many years, he has been very actively associated with UNICEF. And presently, he is the WASH officer, UNICEF Mumbai, and became very much part and parcel of COVID-19 pandemic response program at Maharashtra level, which was part of a Jeevan Track and a collective of more than 150 NGOs cut across various states. And I request Anand to share his experience of engaging with various civil society, because there is no other organization than UNICEF. We can also give a kind of government perspective and NGO perspective very clearly. And I request Anand to share his experience and lessons learned from COVID-19 pandemic response. Welcome, Anand, for sharing.
Thanks, Matthew and CYDA team. Let me wish all a Merry Christmas and very Happy New Year. And I know with this 2020, am I audible?
Yes, go ahead.
So with the experience of 2020, I think we have learned many things. और हम लोग शायद इंतजार ही कर रहे थे कि ये 2020 कब खत्म हो जाए और हम लोग कब जाके इससे भी थोड़ा शॉर्टर वर्जन का गेम खेलेंगे और हम लोग इससे बाहर निकल के वी विन दिस as early as possible. So this is a anniversary day, a foundation day for CYDA. So I congratulate for the 22nd, 23rd, I would say the beginning of 23rd year. Now, kind of grown up organization, and I was listening that you have about more than 80 staff working across several states. So it was a pleasure to watch and work with CYDA during the COVID pandemic, particularly in Maharashtra. And I think we have really taken the response to a new height and a new level. If we look back at 2020, I think there are many lessons which we have learned, and thanks to Milind, I think he had very comprehensively presented on the learnings, and in a very kind of in-depth analysis of what Matthew just mentioned, that he had met over 50 person and interviewed and asked and discussed and interacted with them. I think the presentation is very comprehensive, and I think this also can be a very learning opportunity. This can be really converted into a very good learning resource material. So thanks for that, and thanks for inviting me for this event. And from my end, I think I think you all have implemented the program, the response so far, and I think you are the better judge or better people to kind of understand more than what I can say about it. In my view, I think I have a few points to share, which definitely are not really programmatic, or I would say in terms of what we can say is that overall experience of what we could learn from the pandemic. I hope you're able to see my screen. Hello?
Yes, we can.
Yeah, thanks, Matthew. So while looking at a lot of material and a lot of response reports, interaction with many of you, I have personally discussed with all of you, many of you, I would say not all of you, but many of you. And I actually looked at one of this painting done by a student. He's a standard 7th student, and hardly, his age must be around 13 or 14 years. And look at the kind of pain or the creativity that had brought him inside him because of this COVID-19. Essentially, I think we all have ended up in doing more of COVID response or a response to a pandemic rather than doing a very new natural programming or a developmental programming. If we have to look at the overall learning, I would say the pandemic really had inform us कि हम लोग अकेले काम नहीं कर सकते हैं, और मुझे लगता है कि पैंडेमिक के दौरान हमारा कॉन्फिडेंस वाज शेकन. Many times we were in deep thoughts, करना क्या है, and then of course next question is कैसे करना है. So ये मुझे लगता है कि बहुत बड़ा एक लर्निंग हमारे लिए रहा है. So what next time? In fact, जब इस तरह की सिचुएशन में हम आते हैं तो हम लोगों को डेफिनेटली एक रे ऑफ होप दिखता है. Somebody walks few miles or kilometers or steps in front of you, and you also look with a ray of hope that yes, कुछ तो करना पड़ेगा, because silently this is not going to be carried away, or this cannot be handled if we remain silent. I think we learned a lot, and one of the learning is that we understood that the trust has to be increased. विश्वास हमारा बढ़ना चाहिए, बढ़ाना चाहिए, एंड हमको दो चीजें इसमें करना बहुत जरूरी था. एक तो लोगों के ऊपर में भरोसा रखना और ऐसी सिचुएशन क्रिएट करना सो दैट पीपल ट्रस्ट अस. सो ये एक आई थिंक वाज अ बिग लर्निंग. इनिशियली थोड़ा सा था साइको सोशल स्ट्रेस की बात अगर हम करेंगे, थोड़ा डिस्क्रिमिनेशन की अगर हम बात करेंगे, तो शुरुआती दौर में बहुत ऐसी चीजें सामने आई कि किसी को अगर कोविड इन्फेक्शन हो गया तो वो क्या करेगा, मतलब क्या हम उसको बॉयकॉट करेंगे, क्या हम उसके साथ में काम करेंगे, या उसको हम लोग सपोर्ट करेंगे. ये मुझे लगता है कि क्योंकि ये सदी का पहला पैंडेमिक था, आई विश एंड आई रियली प्रे दैट ऐसी चीज हमको शायद हमारे जिंदगी में नहीं, अगले आने वाले जिंदगियों में किसी को भी ना देखनी पड़े. सो लेकिन साथ में हम जो सीखे हैं इससे कि एक कि हमको सपोर्ट लेना है और सपोर्ट देना है. इट्स अ गिव एंड टेक रिलेशनशिप. आई थिंक अगर हम सपोर्ट देंगे नहीं तो हमको शायद सपोर्ट नहीं मिलेगा. अगर ये प्रोसेस चलती रहेगी, एक्सटेंशन ऑफ सपोर्ट एंड सीकिंग ऑफ सपोर्ट, आई थिंक ट्रस्ट बहुत अच्छी तरह से बिल्ट हो सकता है. मैं ये इसलिए यहाँ पे कह रहा हूँ क्योंकि वी हैव टू कैरी ऑन दिस. अगर नेचुरल प्रोग्रामिंग जो हमारा डेवलपमेंट प्रोग्राम की अगर हम बात करते हैं तो उसको भी अगर इसी तरह से हम लोग अगर आगे बढ़ाएंगे तो आई थिंक वी विल मेक वंडर्स, वी विल मेक अ बिग डिफरेंस। तीसरा बात जो था, थोड़ा सा मैं क्रिटिकल हूँ इसके बारे में कि चाहे गवर्नमेंट हो चाहे सोसाइटी हो, आई मीन व्हेन वी टॉक अबाउट सोसाइटी, उसमें सब लोग आएंगे, सिविल सोसाइटी ऑर्गेनाइजेशंस हैं, नॉन गवर्नमेंटल ऑर्गेनाइजेशंस हैं, वर्किंग ग्रुप्स है, all those who are not part of government but were working with the government. मुझे लगता है कि हम सबकी इस पैंडेमिक में पोल खुल गई है। You know, none of us were really prepared. There's no point in, I think, blaming government or blaming X organization or Y organization. I think we appreciate that कि ये सब कुछ होने के बाद में भी जिसको जो करना था, जिस लिमिटेशन में करना था, जिस कैपेसिटी के साथ में करना था और जिस कंस्ट्रेंट के साथ में करना था, मुझे लगता है कि हम सभी ने किया है इसमें, वेदर इट इज गवर्नमेंट। अगर गवर्नमेंट की अगर हम बात करेंगे तो जस्ट इमेजिन कीजिए कि हमारे पास में अगर फ्रंटलाइन वर्कर्स नहीं रहते, सैनिटेशन वर्कर्स नहीं रहते, हेल्थ वर्कर्स नहीं रहते, तो हम कहाँ पे जाते? आई थिंक वी रियली लर्न कि हमारी क्या तैयारियां थी, क्या तैयारियां नहीं थी। एंड डिजास्टर्स के जो अभी मिलिंद जी ने बताया कि कुछ जो स्पॉट या कॉन्टेक्स्ट स्पेसिफिक डिजास्टर्स है, उनमें तो ठीक है, वो चला, मतलब उसको हम लोग मैनेज कर पाते हैं, बट पैंडेमिक जैसे सिचुएशंस में इट इज वेरी डिफिकल्ट। और आई थिंक हमको इसके बारे में रियली बहुत काम करना जरूरी है। अनफॉर्चुनेटली आप सब लोगों ने आज सुना होगा कल रात को जो किस्सा हुआ है भंडारा डिस्ट्रिक्ट में हॉस्पिटल में। आई मीन दोज पुअर चिल्ड्रन, आई वोंट से पुअर, बट आई थिंक से कि पुअर इन नॉट इन दैट सेंस, बट वो बेचारे अभी 30-28 दिन के भी नहीं थे, उनको अपनी जान गंवानी पड़ी। जो 10 वी लॉस्ट 10 बेबीज जिन्होंने शायद दुनिया भी देखी नहीं है, शायद उनकी आंख भी नहीं खुली होगी। सो दीज आर सम ऑफ द थिंग्स व्हिच वी नीड टू रियली लर्न फ्रॉम दिस पैंडेमिक। एंड दिस, ये जो पोल खोल की मैं बात कर रहा हूँ, मुझे लगता है कि हर जगह में हमको हमारी पोल देखनी पड़ेगी, उसको खोलना पड़ेगा एंड उसको हमको समझना पड़ेगा, हमको तैयारी उस तरह से करनी पड़ेगी। एंड कोविड के दौरान कोई ज्यादा डिफरेंस नहीं था, कोविड के दौरान भी शायद इसी तरह की सिचुएशन हमको देखनी पड़ी। लास्ट में जो कहना चाहूंगा इसमें कि जो हम लोगों ने इस पूरे पैंडेमिक के दौरान दो चीजों के ऊपर में काफी अच्छा काम करने का कोशिश किया, सभी लोगों ने, चाहे नेशनल लेवल पे हो, स्टेट लेवल पे हो, डिस्ट्रिक्ट लेवल पे हो, इवन आई वुड से ग्राम पंचायत लेवल या अर्बन लोकल बॉडीज के लेवल पे हो। टेक्नोलॉजी और इनोवेशंस, ये दोनों को हमने काफी अच्छी तरह से इस्तेमाल करने का कोशिश किया है। फॉर एग्जाम्पल अगर हम देखेंगे कि जो अभी जूम प्लेटफॉर्म अभी हम यूज कर रहे हैं, मतलब आज लगभग 1 साल हो रहा है हम लोग एक दूसरे को मिल नहीं पा रहे इन पर्सन, फिजिकली, फेस टू फेस, लेकिन ये टेक्नोलॉजी की वजह से शायद ये पॉसिबल हुआ है कि हम लोग अभी एक दूसरे से इंटरेक्ट कर पा रहे हैं, बात कर पा रहे हैं, समझ पा रहे हैं। वी आर एबल टू काइंड ऑफ असेस द सिचुएशन। सो डेफिनेटली ये टेक्नोलॉजी ने एक बहुत बड़ा डिफरेंस यहाँ पे हमको दिखाया है कि वी कैनॉट गो अवे विदाउट टेक्नोलॉजी। हमको आगे बढ़ना है तो हमको टेक्नोलॉजी का यूज करना पड़ेगा, शायद इससे और अच्छी टेक्नोलॉजी आएगी। ये यू नो देयर इज अ सेइंग कि एवरी सेकंड टेक्नोलॉजी चेंजेस, यू नो देयर इज एन अमेंडमेंट इन टेक्नोलॉजी। हमको उसके पीछे भागना पड़ेगा, उसके साथ में हमको रहना पड़ेगा। लेकिन ये सब करते हैं, सब हम इनोवेशंस की बात करते हैं, टेक्नोलॉजी की बात करते हैं, मुझे लगता है कि जो बिहेवियर्स हमारे हैं, चाहे वो सीकर्स के हो, चाहे वो जो सपोर्ट एक्सटेंड कर रहा है, ये बिहेवियर्स बहुत मैटर करता है। अगेन इट इज रिलेटेड टू योर कॉन्फिडेंस, योर ट्रस्ट और योर प्रिपरेशंस। जो खोल खोल की अगर हम बात करेंगे तो मुझे लगता है कि बिहेवियर, क्योंकि आपके पास में सुविधाएं है, रिसोर्सेस है, लेकिन आपके पास में अगर उस तरह का एटीट्यूडनल बिहेवियर या हमको किसी को अटेंड करना है, इस तरह का बिहेवियर नहीं होगा तो शायद हम लोग कुछ नहीं कर पाएंगे। सो ओवरऑल आई थिंक काफी अच्छा ये लर्निंग रहा है। इट केम एट अ कॉस्ट, है ना, इसके लिए हमको बहुत सारी जानें गंवानी पड़ी, बहुत सारे हमारे इकोनॉमी जो आज के दिन में देखेंगे हम, तो आने वाला समय तो इससे भी बेहतर, मतलब डिफिकल्ट होगा, क्योंकि अभी हमने तो शुरुआत की है। अभी इम्पैक्ट जो होगा कोविड का, पैंडेमिक का इकोनॉमी के ऊपर में, वो हमको अभी आने वाले 2 साल में, शायद मुझे लगता है मार्च अप्रैल के बाद में इसको हमको देखने को मिलेगा। तो हमको इसके लिए तैयार रहना बहुत जरूरी है। एंड आई थिंक लास्ट टाइम द most important thing, all of us, whether as a service provider, service seeker, society, government, I think एक बहुत जरूरी चीज हमको देखने को यहाँ पे मिली कि हमारा जो रेजिलियंस है towards this pandemic, it was definitely with some sense of responsibility. So if we have to stand up with this kind of pandemic, or I would say let's learn from pandemic, let's then use this learnings from the pandemic for managing the epidemics, for managing the small outbreaks of diseases, for managing the small डिजास्टर्स, और आने वाला समय अभी आप लोग देख रहे हैं कि जनवरी महीने में अगर महाराष्ट्र में इस तरह का वेदर कंडीशंस हो सकता है, बारिश हो रहा है यहाँ पे, सो क्लाइमेट रेजिलियंस है, क्लाइमेट चेंज है, ये आने वाले दिनों के हमारे पास साथ में बहुत बड़े चैलेंजेस है। तो मुझे यही एक आशा है कि जिस तरह से हम लोगों ने यहाँ पे काम करने का कोशिश किया, वो let us continue, let us strive for that, let us make our contribution, let us see that how we put everybody in a, if not comfortable position, but at least in a position where people can sustain their livelihood, people can sustain their lives. So I think जो मुझे लगता है कि ये पैंडेमिक में मेरे लिए तो बहुत पर्सनल लर्निंग रही है फैमिली फ्रंट के, क्योंकि मैं जिंदगी में कभी नहीं सोच सकता था कि 8-10-9 महीना मैं घर के अंदर में 4 दीवारी के अंदर में रहूंगा। मतलब मेरे रिश्तेदार पूछते थे कहाँ पे हो, तो आई हैव टू से कि मैं इस दरवाजे पे हूँ और उस दरवाजे पे हूँ या उस खिड़की के पास में हूँ। देयर वाज नो अदर आंसर। और लेकिन इतनी भी बात ये अच्छी है कि फैमिली के साथ में हमको रहने को मिला, फैमिली के साथ में हमने बहुत अच्छा समय बिताया। हम शायद फैमिली लेवल पे जितना अपने बच्चों को, अपने वाइफ को, अपने पेरेंट्स को, अपने सिबलिंग्स को नहीं समझ पाए, अपने एल्डर्स को नहीं समझ पाए, अपने जो बच्चे उनको नहीं समझ पाने का मौका मिलता, वो शायद I think let us go ahead with this, what preparations we did, how we learned from this, and how we need to kind of bring these learnings into practice for the betterment of the society. So once again, thank you, CYDA. Congratulations for doing an excellent job and reaching out to, I think, not less than 2 to 3 million people, I would say, just to a rough estimate. And you had made a difference for those people who were really in dire need of, support. So again, congratulations to entire CYDA team and entire, I think I would say humanity for, so far sustaining, so far managing this pandemic. So thank you, Matthew, for the invitation. And
thank you very much, Anand, for beautifully, looking at in a different perspective and also providing us, looking at the, opportunities as well as looking it in a very positive way. I mean, I'm sure that the contribution of UNICEF, it was really helped, large number of NGOs in Maharashtra, and that is that connection also benefited where it was really needed, especially the community toilet, in the area of slum, in the area of health, especially in the areas of health, it was really supported in many ways. I mean, we will still continue, and the next, I'd like to introduce Mr. George Chira. Mr. George Chira has more than 30-35 years of experience in the voluntary sector and very active, especially when pro-people-centered engagements and issues. And he has been for more than many years part of Tereda's Home Asia program, and contributed extensively, even during the time of emergencies. George's experience not only limited to the Indian context, but also in the South Asian context. I like to acknowledge one thing, that when we started our ration kit distribution on 28th of March, we didn't have anything to provide, any hardly 50 to 70,000 rupees we had, but the first support come from the children, the Help for Children in Need Foundation, and then from there onwards, Georgia has been closely monitoring how the CYDA has been working and also supporting, silently and also financially and many other ways. I request George to, look at both the million presentations and also the perspective Anand Godke shared, and provide his input to what we can learn from both, and then probably we could continue see that we are well prepared for the days to come. George, can you? I request George give his remarks and suggestions.
Thank you. Thank you, Matthew, for your very generous words of introduction. In fact, there have been so many words that what I have to say will be less than those words. Uh, uh, First of all, let me join everybody to congratulate CYDA. I was wondering how I would start, and I thought I would start with a word like impressive. That CYDA has done impressive work during this pandemic, and they have made significant contribution in Pune and around. And I would consider it as a privilege to have been associated with CYDA in these days, which we still continue. I think a lot has already been said. I really don't think what can be added. I think one of the aspects that we also had to think of in the course of all these activities was the safety and protection of our own. Because unless we are able to keep our own flock safe and protected, then we will not be able to continue our mission, continue our work. In between, some of us raised alarm with Matthew and with others about, the necessary kind of PPEs and things like that. But I must admit that finally, I think we have done a good job of looking after our colleagues as well. Well, on the other side, see, I certainly agree with the points raised by Milind, and also would like to join issue with Anand that when we raise critical issues, what we are doing is not blaming anyone. We are sort of learning together, and we are saying that all of us together should move in this direction. It is not to say that not to sort of point fingers against anybody, but it is just to engage in a collective critical exercise so that we are better prepared for the next calamity, as it was already mentioned, which could be, for example, the climate change related issues or various other issues and so on. So I consider it important that at moments we stop and reflect, and also reflect critically so that we can learn from our own actions, from our own omissions, and also from the actions of others and probably omissions of others and so on. And that's the only way we can really constructively move forward. I also would like to remind all of us that let us not think that the pandemic is really over and our job is fully done. At least I don't feel so. I think we need to continue our preparedness. We continue to be ready to do more in the coming days. And even regarding the unfolding of the vaccine and so on, there could be many areas where we could render our services as well. And as it was already said, it is important to join hands with the local governments and authorities in moving in this direction. As far as going back to the work, particularly in the initial days, I feel that one of the areas where we probably could have done better was also to try and, you know, help the communities and also those populations who were in the movement, like those who are called migrant and so on, by helping them to access official support and official resources as such from the governments or allied structures, which somehow did not happen. Like it was already mentioned that the public distribution systems could not function effectively and so on. And those could have been areas where we probably could have done little more jobs, little better, I feel. I think one of the very challenging things which we did was this whole community engagement and localization of work into different locations like Erwada, Tadiwala Road, Gorpadi, and Nagar Road, slum areas, and so on. I think which now has somehow paved the way for long-term engagement with these communities and you know, long-term stay in these locations with our presence and with our support. I think the kind of initiatives we have taken in education, in sports, and in various other sectors also need to be mentioned. So once again, let me congratulate and thank every one of us who have been part of this massive effort, massive from the point of view of our own resources, our own capacities, and so on. And let's be prepared. Let's be prepared to continue doing our share in the future in collaboration with all sections of the society and of the governments at different levels. Thank you all. Congratulations again to CYDA and to everybody concerned. Thank you.
Thank you very much, George. I think for giving a kind of a direction. There are three things what you said, that the pandemic is not yet over, and also the impact resulted out of the pandemic we still need to work on, whether in the area of economic, livelihood issues, or the health related issues, or education related issues. And also I agree with you that this was given before pandemic. CYDA's engagement was in isolated and limited to children or youth, and now it has become at a community level engagement and engaging deeply with the community, and see that how community can contribute, become more active. I really agree with you. I mean, giving that perspective. Now, I think we are almost reached the last, part of the presentation. Now, I invite Mrs. Bedi, Managing Trustee, Development Support Team, and also an advisor not only to NGOs within the country, and also to associated with various NGOs and international development organizations outside India. Mrs. Bedi has been part of a international organization, Oxfam, Australia, for many years. Mrs. Bedi's engagement started with administrative in Maharashtra as in the Department of Women and Child Development, and again opted to come to a in the voluntary sector. And with wide experience, I can sure that Mrs. Bedi always used to call and give suggestions, and also support during entire relief for the last 9 months. And probably Mrs. Bedi will be able to give us a larger perspective and way forward, maybe coming days to come. Now I invite Mrs. Bedi to share his experience and also his suggestions for the future, and also lessons learned from last 9 months. Mrs. Bedi, welcome you to share your experience. Hello, Mrs. Bedi.
Tell her to unmute her. She's
No, they are going to unmute me, I
Okay,
tried
okay,
to
okay.
unmute myself.
Yeah. Now you can speak. We can hear you.
Good evening, everyone. I would like, first of all, to thank all engaged with the CYDA for their 22nd anniversary. Wilmer, Matthew, the entire team who are present today. May the year be very rewarding and we may soon see the 25th year and scaling newer heights. Also, today has been a very special day for me because, while Milind was sharing his report, I in my own mind was going back to all the work that, maybe George, Milind and I have done together. And in disasters like Latur, Bhuj, traveling together, dealing with the situations, understanding. And based on all of that, when this COVID relief operations are undertaken by CYDA, I thought I should make a suggestion that the whole process should be documented and shared, because still very many questions get asked about what is the civil society sector doing, because probably in the public domain we don't share, and we are so busy doing our own work and we forget that aspect of the site. Since the report is such a beautiful document, Milind, and my personal thanks to you for making it so comprehensive. You've given the introduction, you've analyzed the whole extent of the work done, you've identified the problem areas, and you've given the analysis. Nothing better could be expected, on behalf of the collective team that implements this program, NGOs who were part of it, the donors who were part of it. I take this privilege to thank you for the work put in. Question then there is, where to from now, and based on the analysis of the problems that you spelled out, I think all stakeholders have a responsibility in this. Before going into that, I just want to take 2 minutes of all of you to share that, I have experienced what it means to be in the disaster. I was born in Pakistan, and when we were very young, we had to leave the country. And the family saw, killings, the migration, and losses of life, livelihoods, everything. And my father, who was then a young person working with the British Army, gave me one mantra and gave that mantra and followed that mantra all his life, was human lives matter. And the impact, that fear, psychosis, that instant left on us. We wanted to move away from the borders as far as we can so that, we are not attacked a second time. This is what happens, Overnight, within hours from everything, we were up to zero, living in refugee camps, traveling on trains, overheads, we managed to reach Pune. The second part of my life and why I am part of all these things is that as women and as a woman, I think these disasters, development, everything leaves a double impact. Milind has just highlighted how gender aspects are forgotten in planning and aid distribution, it's just taken for granted. And even we remember when we were in Latur, milk was being distributed, the women wouldn't come forward because they never extended their hand to receive things, you know. The children were dying of hunger. Now, to deal with these situations, I know there's a lot. And somewhere along that, when my father's life changed, the family changed, our assets were lost. He lived all his life as a simple man, educated his children. He never amassed wealth. And he said, stand on your feet. Human lives matter, you know. And I think this is the message I would like to give all my colleagues who are there and who've seen this pandemic. And we have to be thankful that we are all safe. George has just said it, you know. And somewhere along that journey, you know, my whole faith built up that community is the answer, you know. Fortunately, you know, I went into sociology, but if there was community development, I would have liked to do that, you know. And while I was working in the government, went to Oxfam, and now that I am, you know, doing free kind of support programs, I have tremendous faith that when the community gets engaged, you know, they can make governments accountable. They can reach out. There is a lot of unutilized, unearthed power within our communities. Question is, do we engage them? And if we want to engage them, how do we engage them? You know, and I think Milind has brought out that analysis very uh, rightly. And people say if you have to do as citizens, you know, we get troubled and then we come together. But we're not mandated by any legislation. So I think strengthening the 74th legislation so that, you know, the citizens group, the ordinary citizens group can participate in governance, can be accountable, make the governments accountable, but also render services, you know. There is so much in the report and so much work has been done that I think we now have to think where to from now. And the post-COVID agenda is, I think, very well spelled out in Millen's concluding pages of the report, which I just managed to read last night, you know. And I think between the groups, you know, not one agency or one network can do all the tasks and all the problems that are spelled out in that. I think we'll have to get together, take upon the responsibilities, you know, who would do what. And unless we strengthen our advocacy component and try to address the major problems that are causing our disasters, you know, I don't think we would reach much, you know. Somewhere along this 30, 40 years that I've been associated with this sector, I know there was a time, Milind, George, and many of you, Matthew, all of you may agree with me, that being in the civil society and doing something for the communities was considered as a great thing, you know, very respectable, great, you know, that you're doing something. Why is it that space is getting, you know, squeezed? That reputation is being tarnished? What is it that is leading to all that? I think we have to collectively get back that space, assert our presence, and nobody on this earth can live without the community support, without civil society support. I think we have to collectively join hands with communities, with the governments, with the donors, because all our stakeholders to make this world a worthwhile place for all. Thank you, Matthew, for having me. And I have enjoyed the entire evening sitting and listening to all my colleagues and amazed that even after years of work, you know, they're not tired. And we continue with the passion that we had met George, Milind 30, 35 years ago. And it's a great bonding. Let that message be for the youngsters who are going to join us that, you know, if you are committed and if you do collective work, you know, the world is yours. All the best to everyone in the room. Thank you. Thank you so much.
Thank you very much, Mrs. Bedi. And I think I will never forget the word, you know, human matters. And I think that is very apt for this, you know, pandemic time. And I mean, you have really concluded it very well. And I think we need to really, you know, I mean, reflect on that. And probably this document is a very good, you know, foundation for that reflection. Since it is very late, I will be taking one question from Dr. Rajendra Vate. I mean, he's just wanted, and then we will get into a vote of thanks kind of situation. Dr. Rajendra Vate, since you have something to comment or question, please go ahead. I mean, Praveen, can you unmute?
कर दिया
Yeah, can you unmute?
हाँ राजेंद्र जी आपको को-होस्ट किया है
Rajendra,
Okay, yeah. Thank you, Matthew. I don't have a question. I just wanted to congratulate CYDA and thank you very much for my engagement. I was fortunate to have associated with CYDA for an UNICEF project of BMW and WASH in Pune City, Pune Municipal Corporation. You are doing commendable job in the community along with the government sector and the UNICEF. And I consider myself very fortunate to be a part of the small project, of course. I mean, the small engagement. Our project was very big, but my engagement is very limited. So thank you very much, and all the best for all entire CYDA team. Thank you so much.
Okay, thank you very much. I think there is no other way we could celebrate with the this 22nd anniversary of CYDA with such a wonderful friends of CYDA. Now I leave it to Praveen. Praveen, please go ahead.
Okay. Thank you, Dr. Rajendra ji. Thank you, Matthew. Thank you, Anand ji. Thank you, Bedi ji. And thank you, Milind ji. अभी हम लोग लास्ट सेशन की तरफ जा रहे हैं जो आउट ऑफ थैंक का है. मैं आउट ऑफ थैंक करने के लिए बुलाना चाहता हूँ प्रियंका शर्मा जी. प्रियंका शर्मा जी CYDA के बोर्ड मेंबर है और लास्ट 20 ईयर से सोशल सेक्टर में काम कर रहे हैं. प्लस अभी वो प्रजा ऑर्गेनाइजेशन के साथ काम कर रहे गवर्नेंस के मुद्दों को लेके. तो मैं उनको रिक्वेस्ट करता हूँ कि जो लास्ट का आउट ऑफ थैंक का सेशन है आप वो कंटिन्यू कीजिए.
Thank you, Praveen. Thank you everyone for making CYDA Day a very special day. Thank you, Milinji, for the whole presentation, such an enriching study that gives us so much of motivation to do more in the disaster and pandemic and otherwise also. Thank you, Anandji, for the motivation and the experience shared by you. Thank you, George. Thank you, Miniji, for all the words for CYDA and for your sharing of your life, plus the whole making this whole 3 hours meaningful for us also. And thank you, the board members, and special thank to the whole CYDA team who made the whole thing possible, who is basically the backbone of the whole work which we do. And yes, we always celebrate our anniversary, and we are very grateful that you all are part of this. Thank you so much. Yes, Praveen, you can announce the session close.
Yes, thank you, Priyanka ma'am. So Matthew is saying something. Matthew,
yeah.
Matthew's voice is not
thank
clear.
you to everybody. We will send report to everyone. It will be also uploaded on the website of CYDA for public reading and also further use. If anybody has any questions, please get back to us. Thank you once more.
Thank you.